This is Molly Richards again, and this is kind of part of our video segment about doing certain procedures and setting up in the adolescent medicine or family planning clinic. This is how you set up for a wet prep. This is not something that you have to do by yourself, and attending will always help you. But if you did need to set it up initially by yourself, this is what you would do. You always can have different samples, but these are the samples you might most commonly have. A lot of people do it in these tubes. One may have saline and one may not. They should all be labeled. They aren't right now, but they should all be labeled with a patient's name. You can also do a wet prep and a trichomonas assay just by using these red top tubes, if you would rather. This is also something, sometimes we'll do self-vaginal swabs, so the woman will actually swab themselves, and this is usually what you use in that case. So when you come into the lab, obviously you're going to be wearing gloves. This is the area for the microscope. You have to try to keep it as clean as possible. Always put your tubes that are labeled in here, and the first thing you're going to do is set up for your wet prep. So, if you can see, there should be all your supplies here. Here are the microscope slides, and you're usually going to set up two, one for your saline prep and one for your KOH. If you have one that already has saline, these don't have anything on them now, but we'll test. You actually kind of swab it on the slide like this, so you get a sample, okay? If there's already enough saline on it, you might not need to add more. If there isn't, you should, and usually 1 drop will be fine, since you don't want to dilute your sample too much, okay? And then you take a cover slip, which is here, and you put it on like that, okay? So that's your saline sample. When you go to the microscope, you're always going to start on, it's pretty much the second lowest setting, which is, I don't know what the actual magnification is, but it's the yellow one, and you put this under here, okay? You always have to be very careful with your sample, especially when you're using the KOH. You do not want it to touch the lens itself, because that will dirty and mess up the lens, so be careful. The light is on this side. This is how you turn the microscope on. Okay, and then when you look under it, there's a couple ways you'll focus it, and you kind of will get used to it, but there's a big focus where you'll move this, so that moves it up and down, so you can get kind of a clear focus. The other knob is fine focus, and this one moves the slide up and down and side to side. Okay, so you'll kind of get used to that. There's other things like adjusting the light and the contrast that you may use or may have somebody help you with, so you want to try to get a good vision of the cells. Once you get a good vision of the cells from above, from kind of a wide spectrum, you're looking for anything moving like trichomonas, anything that might look kind of stick-like, like yeast, or for a lot of white blood cells, then you can usually move it to a higher level. And again, you want to make sure that it's not so high that the lens is going to hit the microscope. And when you move it to the higher level, you should be able to see your cells better, to look for things like clue cells, trick, white cells, and yeast better. Okay? So that is your saline slide. You should be able to see almost everything on a saline slide, including yeast, although if there's a lot of cells or a lot of discharge, often you need a KOH to help you. And the purpose of the KOH is it really kind of blows out all the other cells and leaves the yeast, so it can make them easier to see. When you're doing your KOH, you'll use your own sample. You can use a sample with saline or without, doesn't matter. Often you'll smear it on here, and then there's a KOH bottle here. Okay, it says 10% KOH, and you'll drop, 1 drop here, and you can do the whiff test. Okay, and that's where you kind of wave and you look for a fishy odor, or try to smell a fishy odor that could be indicative of bacterial vaginosis or trichomonas. And then you use the cover slip as well, okay? And then you do the same thing. Again, starting back on the yellow, the lower magnification, and going to the blue. And again, being very careful you're not hitting the slide with the lens, okay? When you're done with everything, and you can always have an attending look, you need to make sure you clean this area up. That's really important. The glass slides go in the sharps container, okay, which is on the wall. You'll throw those away. All your samples, unless they're being sent to the lab, should be thrown away in the biohazard bin, okay? Everything else should be left in here, all right? If you have a sample that you need to send, you have to make sure the sticker's on it. You have to make sure your initials, the date and time are on the stickers, okay? Then you put it in a bag, sorry. These are the biohazard bags. You put it in. The order should be right here, potentially, or on the printer. You put that in, and you leave it here for the MAs to bring to the lab. And then if you have any questions, you can always ask.
Perfect.